Hi there folks, this is Dr. Burke Mays. I'm a practicing chiropractor here in the western part of Minneapolis-St. Paul area. I've been practicing for over 18 years. And over those years I've worked with a wide range of people, from little babies to the elderly, from the acute injuries like car accidents or sports injuries to the chronically affected people who have been affected by things for a long period of time. And I'm here today sharing with you how we successfully address peripheral neuropathy using neurometabolic protocols here in our office. I'm going to be talking more about what neurometabolic protocols are, but just essentially it means that we look at people both neurologically and metabolically, and we treat people both with very focused neurological care as well as like nutritional care and diet and lifestyle changes. And we also want to talk about what peripheral neuropathy is, what it isn't, what causes it, and really, most important of all, what can be done about it. Because here the reality is, folks, medicine has little or no answers for peripheral neuropathy. And I'm not going to bash medical care. I mean, that we have a really great acute care system. However, there's a lot of shortcomings when it comes to addressing chronic conditions with people. And as far as peripheral neuropathy, they really don't have any good tools to work with. If you are suffering peripheral neuropathy, you might be on some medications like Lyrica or Neurontin, and you might or might not know those have significant side effects. And they aren't even drugs for peripheral neuropathy. They're actually drugs for seizures. And if you're on those, they might be helping you a little bit, but really what you want to start to look at is what's causing your peripheral neuropathy. A little bit about it. It's unfortunately very common. In our country, over 20 million people are affected by peripheral neuropathy, predominantly women. And, essentially what it is, it's a short-circuiting and it's a breakdown in electrical wiring of your body called your nerves. And what happens is that sheath breaks down, information doesn't travel back and forth, and now your brain and your body aren't talking to each other. And we'll do some really simple tests for that. One of our tests we do is with a tuning fork. I'll put a tuning fork on a person's collarbone, and I'll put it on their thumb and on their feet. And it should feel the same. It should feel a 10 here, a 10 on the thumb, a 10 on the toes. And surprisingly enough, people with peripheral neuropathy can even be as low as a 0. They don't feel that vibration. And the importance of that is if you can't feel your feet, you can't balance. And if you look up any place, the leading cause of death in elderly is the effects of slips and falls. Because if you can't feel your feet, you can't balance. If you can't feel your feet, you're going to trip over things, you're going to fall more often, and it literally is truly getting peripheral neuropathy addressed. Can almost say it's a matter of life and death. You need to be able to move efficiently and safely to avoid injury. What does peripheral neuropathy mean? Just look at the dictionary. Peripheral means away from the center, out at the edge. Neuro is nerves, and pathy means abnormal. It's kind of as simple as that. Abnormal nerves out away from the center of your body. 10 signs of peripheral neuropathy. And you might be experiencing these, or somebody that you know or care about is experiencing these. Things like numbness, burning feet, cramping in the feet, sharp electric pains in the feet, pain while walking. I've heard some people describe it, it's like walking on a bed of thumbtacks. Get prickly, tingly feelings in the extremities, in the hands and the feet. Usually this condition, peripheral neuropathy, starts in the feet. As it gets progressively worse, it starts to show up in the hands and the fingers. The loss of balance and falling, we already talked about that. And there's lots of swelling, lots of weakness. Muscles don't fire, fluid accumulates, and you get lots of swelling in your body, in the body. And the symptoms depend on what part of the nervous system is affected. For simplicity's sake, we're going to talk about 3 major parts of your nervous system. There's what we call the sensory portion. That carries information from your body into your brain. Everything from where your body is, where your joints are. Another test I do with some of the peripheral neuropathy is I have them sit and then grab their big toe, and I'll move it up or down or out to the side, and they have no clue where it is. They've literally lost communication with their extremities. So you have sensory, carrying information in. That information gets processed in your brain, I mean, literally they say 5 trillion bits of information passes through a part of your brain called the cerebellum back here, gets processed, and then information goes back out to your body to tell it what to do. And that information going out is what we call the motor nerves. And lastly, there's the autonomics. That just controls all the housekeeping things, those things that you don't think about. The breathing, the blood circulation, the heart rate, the digestion, the healing, the immune system, all that is part of your autonomic nervous system. And depending on what part's affected is going to show up on what symptoms you're going to experience. And sensation changes. You know, if you're having damage to the sensory nerves, you're going to start to experience things like changes in sensation, burning sensations, numbness, tingling, pins and needles, or just the inability to locate where you are in space, leading to those trips and slips and falls. And you know, as I mentioned earlier, with many neuropathies, those symptoms begin far away from your center, your feet first, and work their way in, and start with the hands and work their ways in. You know, movement difficulties, that's when you have to have breakdown in those motor fibers. Now muscles don't work. You get crampy, you get loss of muscle control and weakness, and loss of muscle bulk, loss of muscle mass. If you also look online, another one of the big indicators for declining health and leading towards death is loss of muscle mass. You really need to keep that muscle mass on your body to live longer. Now, all chronic conditions have some common threads. And when I say all chronic conditions, literally everything. There's common threads. Whether you're having peripheral neuropathy or thyroid conditions. And by the way, all these conditions that I mentioned here we help in our office. And often somebody's experiencing not just one of these, but multiple ones all combined together. So you have thyroid issues, you have insulin resistance, and diabetes. You know, if you're not dealing with your blood sugar, you're not getting blood to your nerves can't fire, they fatigue faster than they should. Fibromyalgia, everything hurts. Vertigo, sciatica, chronic fatigue, chronic neck pain, you know, insomnia, chronic migraine headaches, all come back to neurometabolic imbalances. And some of the big ones are things like anemia. You know, your brain needs good oxygen delivered to it. If you're not getting, and your nerves need good oxygen. If you can't carry oxygen, your nerves start to starve. They start to die off. You start to get nerve death and numbness and tingling. Chronic inflammation. You know, how do we test what chronic inflammation is? And, you know, how do we look for it? Well, first off, chronic inflammation is, imagine like when you sprain a finger and your joint gets all inflamed. But now imagine that inflammation throughout your entire body, affecting everything. How do we test for that? We do things like a C-reactive protein, a homocysteine, fibrinogen, we check for methylation. All are indicators for inflammation. We want to deal with that. Unstable blood sugar. If your blood sugar is getting low and you're having blood sugar drops, you're going to have impacts in your nervous system. You're going to fatigue faster. Nerves are going to die off. Adrenal gland dysfunction. If your adrenals and your liver work together to balance blood sugar, if those are stressed, you're going to have difficulty doing that. Hormonal imbalances, autoimmune attacks. You know, your immune system gets confused and starts to attack your nervous system tissue. A great example of this is Lyme's disease. You know, Lyme's is really sneaky in that the proteins on the cell membrane of the Lyme's bacteria will actually mimic the proteins in your cells. So what happens, your immune system doesn't see it. And then finally, when it can see it, it starts to destroy it. And at the same time, destroys those tissues that are similar to the markers on the Lyme's bacteria, and you develop an autoimmune condition. And that can affect any organ or any tissue in your body. Hidden infections in the gut or the viral infections. Food sensitivities are huge. They're inflammatory, they're immune stresses, and our common ones are gluten, dairy, corn, soy are the biggies, and really any food can be related to it, but those are some of the big ones. Medication side effects, we're going to talk about those in a few minutes. Hypoxia, low oxygen. If you're not delivering the oxygen out to your body, your brain's going to starve. And then the neurological imbalances, that decreased frequency of firing in certain areas of your brain, leading to changes in how your body works. All of those are things we address in your office because they need to be handled. You see, when somebody walks in the door It's not just a matter of giving them a miracle pill or a miracle vitamin, or slapping a certain machine on them, or doing a perfect miracle treatment. It's a whole connection of things all working together, treating you holistically, treating all the areas of dysfunction to start you on the road back to healing. It's a very different concept than the medical model, where it's one condition, one therapy, one result. Now, as I said a moment ago, chronic illnesses and chronic conditions are a combination of neurologic problems and metabolic problems. So guess what? Treatment protocols are going to be addressing neurologic problems and metabolic problems. Metabolism, just a little bit about that. The basics. You eat food, you make energy. And in our bodies, the unit of energy, the end result is going to be sugar or glucose. You know, everything you eat gets converted into glucose, whether it's a steak, an egg, or a cup of sugar. It still winds up as glucose molecules in your bloodstream as fuel for your body. Now, what part of your body consumes most of your glucose or uses most of your energy? Is it the endocrine system, digestive system, nervous system, immune system, cardiovascular? Most people, just kind of out of automatic response, are going to say cardiovascular. And they're wrong. What consumes most energy is your nervous system. So if you took all my nerves in my brain out of me, put them on a scale, it would equal about 2 to 3% of my body weight. And that 2 to 3% consumes 30% of my energy, 30% of my sugar. It uses 30% of my energy. And if you're not having that good energy production, guess what gets impacted first? Your nerves, your brain, the nerves out in the extremity. So some leading causes of peripheral neuropathy, because we see when we start to look at the causes, now we can look at areas to start to address it and treat it. Big one is statin drugs. I'm going to talk more about this, and I'm just going to review these really briefly. Statin drugs are huge. Damage to the back either from injuries or just decades of not functioning properly can lead to arthritis, spinal stenosis, bulging discs, diabetes type 1 or even type 2. Sorry, the main one we can deal with is type 2. Type 1 is also important, and also insulin resistance. There's also, showed up in literature now, we call it type 3 diabetes, where literally the nerve cells, in particular the brain, don't use sugar to make energy anymore. And then, so now they lose their energy production. Remember that 30%? Now they're not using sugar to make energy, and that's a really big problem. Chronic inflammation from food sensitivities, inflammatory foods, hidden infections, poor omega fatty acid balance, high insulin, hormone imbalances, and chemotherapy. Chemotherapy is brutal on the nervous system, as far as causing damage to your nerves. So statin drugs. First off, if you're thinking, well, to talk about real briefly, what's really important is statins inhibit the formation of cholesterol. That's what they're designed to do. Here's the problem. Cholesterol is really, really important in our body. Cholesterol forms the sheath on our nerves. It forms the makeup of our cells. It's a building block for our hormones. It's anti-inflammatory. And when I first came out of school, people would have a cholesterol of 280, 250 was common, considered okay. They started to drop to 225, 200. Now I'm hearing they want people below 180, down to 150. And it just gets to be insane. Because if you look, cholesterol being important, and now you're taking away a really key building block, it's going to cause problems. And I'll talk about what the true enemy is here in a minute, because I'm sure you might be sitting there going, well, my doctor said my cholesterol was 205. I need to be on statin drugs. Statin drugs, you're going to see in a minute, cause peripheral neuropathy, and cholesterol is not the enemy. Statin drugs inhibit the formation of a nutrient called coenzyme CoQ10, which is critical for nerve function and critical for energy production. So when statin drugs inhibit that formation, they literally knock down your ability to create energy. So now we have that person who they're trying to drive their cholesterol down to 150. Now they're tired. Now their joints ache and their muscles ache. By the way, one of the common side effects of statin drugs is muscle pain and muscle weakness, because it's shutting down that coenzyme CoQ10 production. So now that person is tired and fatigued, and now they get their testosterone, try and jump their energy up. Now they develop cancer. I mean, The whole statin cycle is absolute insanity when you actually start to look at the reality of biochemistry. And this is out of the Journal of Neurology from May 2002. And this stat has even gotten bigger, but this is the first reference I had available. Statin cholesterol drugs increase the risk of peripheral neuropathy by 16 times. That's 1,600%. And actually I've seen newer information where it's actually up as high as 30 times increase in peripheral neuropathy. It's huge. Is cholesterol the enemy? You got to ask yourself, we've been doing this big, huge push for the past 10, 15, 20 years to reduce cholesterol. If that's the case, why has heart disease gone up dramatically since statins come on the market? Why is that? You know, why do areas of the world that have higher levels of cholesterol in their population have lower rates of heart disease? And why is it that just as many people with low cholesterol die of heart disease as high cholesterol? See, the enemy isn't the cholesterol, it's the inflammation. Remember I talked about that finger analogy, but that inflammation you throw out throughout your entire body? Inflammation in your body creates the environment to create plaques and hardening the arteries and a whole host of other health issues. So once again, it's not cholesterol that's the problem, it's the inflammation. Now, if you walk in my door and you have high cholesterol and you have high inflammation, we got a problem. I want to address both of those at the same time. But my bigger target is, what do we have to change to reduce that systemic inflammation? We actually call it meta-inflammation. It's a new term for it. You need cholesterol to form proper nerves and for proper brain function. You need cholesterol to make hormones. You need cholesterol to make your cells. And you need cholesterol to help reduce inflammation. Now, damaged low back pain or damaged lower back can contribute to peripheral neuropathy. If you look in this picture up here, I know it's kind of hard to see on this slide, but we have nerves come out of the low back traveling down your feet, one of them being the sciatic nerve. If that nerve is being compressed and being damaged, that's going to it's going to shut down the information coming from your feet back up to your brain. It's going to lead to problems. One of the things we do in our office, one of our weapons in the arsenal against peripheral neuropathy, we do non-surgical spinal decompression to help open up the space for the nerves, give the nerves an environment so they can start to heal. You know, diabetes and insulin resistance. As they keep saying, we need sugar and glucose for our nerves to survive. If we're not regulating that blood sugar properly, it's going to create problems with our nerves. As well as you can get swings up and down in the hormone called insulin, which helps control blood sugar. Insulin's inflammatory. It's going to cause further damage. Inflammation, as I just said, it's a big deal. It's kind of like trying to remodel your house or build a house while there's a fire going on. You just can't do it. Common causes of inflammation that contribute to peripheral neuropathy: food sensitivities, poor diet, hidden gut infections, hidden viral infections, poor omega-3 to omega-6 fatty acid balance. It used to be omega-3s in a sense are the good fats. Omega-6s are for the large part, the bad fats. And it used to be our diet was about literally about 90% good fat and about 10% bad fat. And now it's flipped completely. Literally our diet is about 90% bad fat and about 10% good fat. And what's that going to lead to? If you're trying to build a healthy body with bad fat, you're going to have a problem. High insulin, we already touched on that. Hormonal imbalances are going to contribute to inflammation. And really what's most important takeaway is that metabolic causes need to be addressed if we're going to actually win this war on peripheral neuropathy. And one of our big tools for that is comprehensive blood work, getting a good view of what's going on with your metabolism. Now, you might have said, but doc, I went to tell my medical doctor. They did a complete lab profile on me. They said I'm normal. Two things with that. The thinking in medicine now is they only test for something that they can change. You know, let's take thyroid disorders, for example. They test two markers. They usually only test one, possibly two. They know that they can give somebody synthetic TSH to help elevate TSH in somebody with hypothyroid. So guess what? That's their only tool in the box. So they're going to be testing for one thing. Does that patient have low TSH? Now they have to give them that medication to help support that. You know, so they only really test for what they can change, which means you're missing a big, huge part of the picture. And the other part is that lab normals are inaccurate because they're using a bell curve. So here's what happens with lab tests in our country and worldwide. Is every year they take all the information that comes in, all the results of all the labs, average them out, find the middle, and mathematically design what we call a normal range based on statistics, and that becomes the normal range for that lab result. Now the problem is, who comes in and gets lab work? The sick people. So what are they basing the normals on? Again, on the sick people. So what we work with in our office is functional lab values. So I kind of imagine it's like a target. The bullseye is perfect ideal health. Off the target is some sort of disease process. There's a big range between the edge of that bullseye and the edge of the target, and that's the functional ranges. That's where we start to work at functional imbalance as opposed to outright disease imbalances. So some examples. Let's just take glucose. Functional ranges of a blood sugar, at a fasting blood sugar, should be between 85 and 100. Lab normals or medical normals are 65 to 110. So in my book, if you walk in my door and you got a fasting blood sugar of 109, you're in that slippery slope from normal blood sugar into diabetes. You're actually what we call dysglycemia or syndrome X. Or say you came in, your blood sugar was 73. Well, according to the medical model, you're fine, you're normal. In my world, you're hypoglycemic. Your brain, your nerves aren't getting the sugar to make the energy. Go on a little further down. TSH, I touched on that briefly. Functional range is 1.8 to 3. Medical normals 0.3 to 5.7. That's a big difference. So if you walk in my door and you're at 4.2, I'm going to say, you might be hypothyroid. We need to work with that. Now, next we want to look at when you can't feel your feet, when you can't feel your body, what happens to your brain? See, actually, for our brain, glucose is a nutrient, and so is movement, so is input, so is information. And if you're not getting that up into your brain, that information not making it, your brain, in a sense, starts to starve and it starts to change. So you cut your nerve, what can happen? This was a journal posted a couple years ago. You cut your nerves or change your nerve function, you get changes in balance. Now here's where that's kind of obvious. If you don't get the input in, you're not going to get you're not going to be able to balance. But now it starts to change memory, depression, anxiety, Alzheimer's, dementia, insomnia. Profound impact on your brain when you start not being able to feel the extremity of your body. See, what happens is a somatotopic map. Everything that happens out here is represented up in your brain. So if you're not getting input into your brain, that area of your brain starts to shut down, starts to not work efficiently. So what does a neuron or what does a nerve need to revive and to repair? One, it needs fuel. It needs well-balanced glucose, blood sugar between 85 and 99. It needs proper oxygen. Are you anemic? Is there pH balance issues in your system that prevent that normal delivery of oxygen? You need to have lower or ideally no inflammation, but that's kind of impractical. But you want to have low inflammation. You want to have good neurotransmitters, and you need to have activation. You need to have movement. You need lots of it. One of the things we'll do with peripheral neuropathy is there's nerves called large diameter afferents. They carry information from your feet to your brain very rapidly, and they respond very well to vibration. So you might do vibration therapy on the feet of a person with peripheral neuropathy. Activation. We're also one of the few clinics in the state. I think the last I knew there's only 2 other ones using what we call HACAMED. HACAMED is what we call horizontal microcurrent therapy. And what it does is it stimulates and fires the nerves electrically with very specific frequencies. It's going to help block pain. It's going to improve nerve flow, improve blood flow to help those nerves start to heal. Stimulates the nerves biochemically, allows for greater metabolism so they can start to heal or reduce the inflammation locally. So it can start to not only stimulate the nerves so they can fire, but give them the environment to start to heal. And we're doing the work metabolically to give them the fuel and the building blocks to heal properly, and the system starts to work together. The The difference between Hakamed and many other different electrical therapies are, there's a lot of different therapies. All have a bioelectrical and biochemical effects on the body. So when it comes down to it, at the end of the day, Hakamed therapy is one of the more state-of-the-art therapies for peripheral neuropathy. And because the important part is, when those nerves start to die off, they have to be stimulated efficiently and effectively. And the Hakamed is just one of the best therapies there is to do that. What else can we do for nerve activation and repair? We talked about the Hakamed. What we call exercise with oxygen therapy. You might have somebody do exercise on one side of your body. Why do we say one side of your body? Your cerebellum is back here in the back of your brain. It takes information one side of your body, processes it, and sends it to the other side of your brain. It's also very glucose dependent and very oxygen dependent. So if I want to wake up one side of the brain, I want to fire the opposite cerebellum. A person might be sitting there like on a hand bicycle, pedaling with one foot, while they're breathing concentrated oxygen to fire that cerebellum, to fire the opposite side of the brain. Vibration with oxygen therapy. We talked about it with the Hakamed. We might do vibration therapy on the feet. And obviously, very importantly, metabolic support. If we're not changing the environment for the cells, they're not going to heal. Rebuilder therapy. Often this is a very simplified version of another electrical therapy. Works at 7.83 hertz. And that's actually the vibratory frequency of your nervous system and your body. So you have that at home, you're wearing that. That's helping heal those nerves when the times you're not in here. So not only do we address the big picture metabolically, but we also, a really important thing is called essential fatty acid cream. It's put on the extremities. Provides nutrients, anti-inflammatory nutrients. They get picked up by the nerves and helps them start to heal, on top of whatever other supplements we decide to work with based on your lab tests. A key point, it takes many different things to address peripheral neuropathy. It's a complex situation. Not just one thing's going to do it. We have to address both the underlying metabolic issues as well as the neurologic issues to have success. But the reality is, this is a progressive condition. It gets worse unless action's taken to stop it and ideally reverse it. And I've looked around. I think that our program is one of the most comprehensive and thorough programs in this area. And there's better things. I'm always looking. For instance, if I was to record this video again in 2 or 3 months, there'd probably be new things on here that I'm not talking about right now, because we're always learning what works. So summary, things we look at. We look at comprehensive blood work. And by the way, a little bit on the blood work too. The panels that I order are very complete. I mean, they range, I think, between 35 and 40 different tests. I get them very inexpensively, like for under $200. If you were to try and get that complete panel through your insurance, literally you might be paying upwards of $1,000 to $1,500, especially if you have a deductible plan. So we get those very inexpensively. We work with the anti-inflammatory diet to allow for healing, to help start to change that inflammatory state in your body. The peripheral and the healing and nerve activation through things like the non-surgical decompression therapy if it's necessary, Hakamed therapy if it's necessary, exercise with oxygen therapy, vibration with oxygen, the essential fatty acid creams, the metabolic work, the blood sugar, the inflammation, all those things all start to tie together. Now, the other thing I want to look at is how bad are you? There's a test we do on all of our peripheral neuropathy patients called the Toronto scoring system. You want to score 74. I very commonly see patients down as low as 10, 15, 8. I think I had a 17 the other day. That means their nerves are dying off. They're really in severe trouble. Things have to be interrupted quickly. So what's next? If you're watching this, you've either seen the information about me on Facebook or online on the internet. And what's next is call my office, make an appointment. Our number is 612-242-0045. You can also reach me by email, which I'll give that to you in a couple minutes. If you're seeing us on Facebook, just respond with a private message. I'll get right back with you. Because what I offer, well, first off, when you come in our office, our first 2 visits look something like this. We do a complete neurological exam, review of your existing labs, and I ask them labs in the past 3 months. If they're older than that, they're very limited value for me. A very thorough amount of paperwork, complex situations. I want to have the full picture of what I'm working with. And one thing I really highly recommend and almost require is if you're in a relationship and you and your significant other make choices together, I really want them here with you. For the reason being, if we accept you as a patient in our office, we're going to be coaching you to make massive lifestyle changes. And you need to have support. You want to make sure that your support people are with you so they know what you're up to. They want to know what you're dealing with and what you're up to. Our second visit is a case review, if I accept your case. I only accept cases that I think that can help. We're going to overview any further testing that might be done. We'll review the neurological testing from the first visit, get an overview of the treatment plan, and talk about the financial obligation. And we'll talk more about that. We'll talk more about that in a minute. And once again, we want to have your significant other with you. And when you show up, you want to bring some shorts and a t-shirt because I need to be able to get to your extremities so I can do my exam. Have all your paperwork done. It really is important. Have that paperwork done. Don't rush it. When you make an appointment, we're going to email you the packet of information. Plan on a couple hours to fill it out. It's very thorough. Don't rush it, because if you rush it, I don't get all the information that I need. Now, I only accept about 5 new peripheral neuropathy patients per month. Reason being, complex patients that take a lot of thinking, a lot of extra work, and we want to have the right time we want to have the proper time to address you. Now, normally our first 2 visits are $450. If you're watching this video and you've gotten to this point of it, when you contact me, say, I watched to the end of the video, and what you'll do is our first 2 visits are going to be for $75. So, so the important thing is, if you've gotten to this, you know what the offer is, $75 for the first visit. And the really important part is you need to be committed. And if you're committed to your case, you must be willing to make some serious life changes, and you must be willing to be accountable for your health. I say it's a really common thing where you fall into this victim mentality. This thing is happening to me. This is something that happened to me. Peripheral neuropathy happened to me. Well, if you're a patient in our office, we're going to start to flip that conversation that you are in charge of your health. You're in charge of what it looks like. And we're going to coach you and support you with the things that you need to do to start to get it back. Now, costs. The insurance question always comes up. The reality is I'm not in any insurance group because insurance doesn't cover this kind of care. And if you really look at it, this is straight out of the Medicare manual, which is the building block for all the other insurance policies and plans. 2014 Medicare manual. I love this, by the way. This is hilarious. A treatment plan that seeks to prevent disease, promote health, or prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition, is not a covered benefit. Isn't that insane? What are they actually really doing for us? According to this, they're not doing a whole lot. So, in our office, when it comes down to the end of the day, when you sit down, I'm going to make my recommendation for you. It's going to be the good, the better, and the best plan. And really, if you can afford between $200 to $400 a month, spaced out over a period of time, you can afford to have care here in our office. So what I recommend you do is, if you're committed, and that's our next conversation, you want to look for yourself. You want to think about this. On a scale of 0 to 10, 0 could absolutely care less. 10, you would walk through a wall and walk across fire to get it back. What's your commitment to your health? And then 2, where do you see yourself in 3 years? As I mentioned before, peripheral neuropathy is progressive. I have yet to see a case self-resolve. Been lucky, I've seen a few people, they might have slowed down just on their own, but nothing's ever gone backwards. So you want to look, what do you see yourself being like in 3 years? What's that impact going to be on your relationships, your work, your family, your friends, your ability to actually enjoy life? You want to look like, what are 3 things that you aren't doing that you would want to be doing again? And I touched on it before, on a scale of 0 to 10, how serious are you about addressing this? I only work with 8s, 9s, and 10s. Anything below that, please don't call. Don't come in just to find out find out what a nice guy I am. Because really, if you do that, I'm not going to be a nice guy. I'm committed to people getting their health and well-being back. So if you just want to come and check things out and kick the tires, don't waste your time. Don't waste my time. Only call if you're an 8, 9, or a 10. As I said earlier, we're a busy clinic. I can only take about 4 or 5 peripheral neuropathy patients a month. If you're seriously committed, give us a call. Contact us. How can you find us? Mentioned before, you can call us 612-242-0045. If you're seeing us on Facebook, just PM back to us. You'll usually hear back within a couple hours. Or you can reach me at my email address. That's drmays@askdrmays.com. So it's drmays@askdrmays.com. Number again, 612-242-0045. Thank you for watching this, and I look forward to meeting you soon and having the opportunity to help you. Thank you. Have a great day.